Preceptor Presentation by Bebina. So, Mrs. Wells is a pleasant 28-year-old African American woman. She was diagnosed with asthma when she was 2.5 years old. She reports that she was at her cousin's house and was exposed to cats, which triggered her asthma symptoms. She notes that her current symptoms seem to be worsened by laying flat, and movement are accompanied by a non-productive cough. Patient presented to the clinic with complaints of shortness of breath and wheezing following a near asthma attack she had 2 days ago. She awakens with nighttime shortness of breath twice per night. At the time of the asthma attack onset, she notes that her wheezes were a 6 out of 10 in severity and her shortness of breath was 8 out of 10 severity that lasted for 5 minutes. At that time, she used her albuterol inhaler and her symptoms decreased, although they did not completely resolve. Since that incident, she notes that she has had 10 episodes of wheezing and has shortness of breath approximately every 4 hours. Her last episode of shortness of breath was this morning before coming to clinic. Chest expansion is symmetrical with respiration, normal femtus, symmetric bilaterally, chest resonant to percussion, no dullness, bilateral expiratory wheezes in posterior lower lobe, bilateral muffled words with notable expiratory wheezes in posterior lower lobe, no crackles. She complains that her current symptoms are beginning to interfere with her daily activities, and she is concerned that her albuterol inhaler seems to be less effective than previously. Currently, she states that her breathing is normal. She has no recent use of spirometry, does not use a peak flow, does not record her attacks, does not have a home nebulizer or vaporizer. She has been hospitalized 5 times for asthma. The last hospitalization was when she was 16 years old. She has never been intubated for asthma. She does not have a current pulmonologist or allergist. She is not aware of any environmental allergen at work or home. She denies current use of tobacco, alcohol, and illicit drugs. She did smoke marijuana for 5 to 6 years. Her last use was at age 21 years. She does not exercise, no acute distress. She is alert and oriented, sitting upright on exam table. She maintains her eye contact throughout her interview and examination. In office spirometry, her FVC is 3.91 liter and FEV1 to FVC ratio is 80.56% and her SpO2 is 97% on room air. So, based on this information, pending further test, I will initially diagnose Mrs. Wells with moderate to severe persistent asthma with acute exacerbation. Since Mrs. Wells' wheezing and shortness of breath happens more frequently, she should also be educated to record her detailed attacks accurately. She should also be educated on how to use the incentive spirometer and monitor her peak flow values daily. Since Mrs. Wells is not aware of any environmental allergen at her home or at work, I would refer her to an allergist to get an allergy testing and to identify minimize known asthma triggers by avoiding allergen and irritants. This is important because symptom management is very important in asthma as well as the symptom prevention. I would also refer her to see a pulmonologist for a more thorough assessment of her lungs, such as the pulmonary function test. Furthermore, her current albuterol inhaler needs to be reviewed as she stated that it seems to be less effective. In this case, probably a low dose of inhaled corticosteroid or ICS can be added to her short-acting bronchodilator, and then I will call her for follow-up. Thank you for watching.